Welcome to Conflict Resolution and De-Escalation Part 2, the art and science of managing conflicts within opioid support service delivery. This training is brought to you today by 3C Recovery Support Training Institute, which is the training academy of the Light of Truth Center, and IRIS, Innovations in Recovery through Infrastructure Support. I am Tyrell Boyd, Principal Facilitator for 3C Recovery Support Training Institute. I have been honored to train, supervise, mentor, and support individuals working in various behavioral health professions since 2012. It's important that as practitioners who serve others, we realize that it's not just important that we serve, it's equally important how we serve. I want to be a part of the process that encourages individuals to serve well. Today, I am joined by my co-facilitator, Vale Leonard. Vale?
Welcome, everyone. So happy that you are here and so happy to be able to provide this service for you. I am Vale Leonard. I am the founder of the Light of Truth Center, a behavioral system of care for women recovering from drugs and alcohol. We've been in service for over 20 years, providing an array of services for women and the recovery community. I am honored to join you today.
Thank you, Reverend Vale. This training is made available to you because of sponsorship of NIH, the National Institute on Drug Abuse, the University of Maryland School of Social Work, and IRIS. Core IRIS activities. 1, data infrastructure and capacity building. IRIS supports organizations to securely collect, analyze, and present data while also developing its own data repository against which organizations can track its progress and create more effective services. 2, recovery research program. IRIS offers funding for organizations to engage in pilot projects to answer important research questions around opioid recovery support services. And 3, training series. IRIS partners with leading organizations like 3C Recovery Support Training Institute to deliver high-quality workshops that relate to research and/or develop capacity for organizations to more deeply evaluate their impact on the field. In today's seminar, we will continue building strategies for dealing with conflict positively. To learn how our bodies and minds manage conflict, we will describe de-escalation techniques, including how to assist upset people, and we will review the importance of self-care to use after conflict.
Well, we're going to jump right in and get started with the 8-step process to conflict resolution. So let's go over the steps. 1, first, we'll identify the conflict. 2, we'll decide whether to intervene. 3, we will identify parties, issues, and emotions. 4, we'll analyze the conflict. 5, we'll design the process. 6, we'll educate parties and get an agreement to participate. 7, we'll then conduct the process. 8, and we are reminded to celebrate little breakthroughs and check in. Now let's talk a little bit more about identifying the conflict. When identifying the conflict, take ample time to identify the conflict. Let everyone get it up and get it out, as they say in the 12-step community. If someone is unwilling or is having difficulty expressing themselves, be supportive. Be patient with everyone involved and be patient with the process. It works. Let everyone share their perspectives and ensure everyone is heard, truly heard. Pay attention. Pay attention when people are sharing. Notice their body language, expressions, and tone. As we identify conflict, let's take a look at communication differences. Many things influence how a person communicates. It is important to acknowledge the varying ways in which we communicate. Stage appropriate. Be stage appropriate. Recognize what that means now. If a person is new in their recovery process or managing new medications, it is imperative that you recognize this and take this into account. Recurring problems. Now, watch for recurring challenges. If this is a challenge that continues to occur and or is experienced by multiple people, especially in organizations, it may actually be a challenge with the policies and procedures. So we need to check the process. Decide whether to intervene. This is very important. Before you intervene, stop, listen, and observe. Knowing when and when not to intervene is crucial. Ask yourself a few determining questions. First and foremost, is it safe to intervene? Is it safe, or is the situation spiraling out of control? What will happen if I don't intervene? And do I need support to address the issue? If it's spiraling out of control, and if you possibly need support, get help. What are the likely consequences of not solving this issue now? And what will be the best and worst possible outcome if I don't intervene at this point? Am I the right person to resolve the issue? It's always good to ask for help. Can I be objective? And do I have the necessary skills to intervene? Now, let's identify who's in the room, so to speak. Identifying individuals, issues, and emotions. Know who you're talking to. Know who's in the room. Are you able to utilize your lived experiences to address and diffuse issues? Think about who you're dealing with. Are you dealing with like-minded people? How does each person see the conflict? And how emotional are people regarding the conflict? Very important to be aware of what's going on in the room. Now, let's analyze the conflict. Let's move forward. What's next? Don't rush the process. Take the time necessary to be reflective and analyze the conflict. What is the basis of the conflict? Can it be resolved informally? What about gender or cultural differences? These must be considered. Might culture, age, gender, or other communication differences have created misunderstandings? What solution is the individually actually seeking? And so, as we analyze the conflict, how does each person describe the conflict? You can now use this information to determine how others place blame or claim responsibility. Some conflicts cannot be handled in an informal process. Now, this is important to note. Some conflicts that involve harassment, discrimination, involvement of children or vulnerable adults, and illegal behavior must be managed in a more formal process. So be aware, when things start to tilt this way, if you begin to recognize that harassment or discrimination, or it involves children or vulnerable adults or illegal behavior, stop and recognize that this cannot be done in an informal process. Resolving conflict in a healthy way. Yes. So let's begin to design the process. Remember, conflict resolution is a process, a tool for managing and resolving conflict. As you continue to use it, you'll become more comfortable with the process. So trust the process. Well, first, let's talk about what a process is. What is a process? A process is a natural phenomenon marked by gradual changes that lead towards a particular result. So this process can be used one-on-one, in a group setting, or when you're addressing an organization. If you learn the process, you'll know how to use it. Use everything you have learned thus far. Everything that we talked about in part 1, now use all of that as we design and prepare for conducting the process. So, what are we going to do now? Let's take a look. What have you learned that would create gradual changes that would lead to a particular result? Think about that for a moment. What would be the goals of a healthy process? One important underlying goal is to establish or reestablish trust and harmony. Now, how will you handle people? Read the room. Be aware of the emotions surrounding the conflict. Remember, as noted before, notice body language and tone. Don't ever underestimate the importance of feelings. Be sure to create a safe space conducive to a resolution. No big I's and little U's. Everyone's opinion is valid. The physical setting can greatly influence the process. Everyone needs to feel safe. Get an agreement from everyone involved. What you hear here, let it stay here. Does that sound familiar? I'm sure it does. Okay, so we've identified the conflict and determined if you or someone else will intervene. You have identified the issues and analyzed the conflict. Now, how do we design the process? So as we move forward, have individuals agree to work things out. This can be tricky, especially if people are very emotional. Do your best to work things out and have an agreement. Set the time and place in which to discuss the issues. If you're in a public place, you want to try to move to a more quiet place. If you're in a residence, then you want to find a place where other residents, other participants cannot hear the conversation, and everybody is safe and willing to be open. Use the information you have gathered and analyzed to initiate a conversation. Be solution-oriented. Talk it through. Take your time. Prepare for finding a solution. Now, it's important to make sure that everybody knows what's going on. So, explain everything that will happen in the conflict resolution process and ask each person if they understand. Now, let's go to work. Remember, look for solutions. Don't dwell in the problem. Keep in mind, the process is a tool. Remember that. Use your tool effectively and try not to deviate. Remember to do the following things. Remember to follow the process. Be confident, be patient, and open to the process. Have people describe their experiences without interrupting. That's important. Don't interrupt now. Let them get it out. Listen. I mean, really listen. Listen attentively. Don't just hear, listen. Everyone wants to be heard. Look for common ground. This may be difficult at times, but do your best to find common ground. Discuss issues openly and honestly. Ask good questions. And remember, manage your own stuff. Stay neutral. Don't take sides. Help everyone unravel misunderstandings and break it down. Break it down to the best of your ability. Okay, so we want to move from solution to resolution. So openly and honestly work together to come up with some possible solutions. Brainstorm, so to speak. Let people throw it out there. What are they thinking that might resolve the issue, or what can we do to move forward? Encourage people to be creative and clear about what is important to them. Identify what you want out of the process, what they want out of the process, and collectively what you want out of the process. Now, once people have identified possible solutions, talk about what feels like a workable, agreeable solution, and then agree to a resolution. Now, resolution and the process, it can be difficult at times. People can be very emotional. Even you, as the facilitator of this, can find yourself emotional at times. So as we work through this and go from analyzing to solution to resolution, when we begin to work together, remember to celebrate. Conflict resolution can be a challenging process. It is important, very important, to acknowledge the work accomplished and the commitment to the process. So remember, celebrate. A celebration can be as simple as a handshake or thank you. Depending upon the situation, a more formal celebration may be in order. However, remember, celebrate.
Thank you. Now we're going to talk about de-escalation. The definition of de-escalation is the reduction of intensity of a conflict or potentially violent situation. And what creates the escalation often is the intersection of what's happening, a person's past experiences, possible trauma related to those experiences, and the complexities of moving towards wellness, that all can create the perfect storm and things can escalate. So these are 10 tips found in Crisis Prevention Institute for de-escalation. We want to be empathic and non-judgmental. We want to respect personal space, use non-threatening body language, avoid overreacting, focus on feelings, avoid power struggles, set limits, choose wisely what you insist upon, allow silence for reflection, allow time for decisions. So let's look at these tips individually. First, be empathic and non-judgmental. Try to understand the person's feelings and perspectives. Reverend Vale spoke earlier about stage-appropriate behavior. Knowing the stages of change and the stages of recovery will help you to identify appropriate behavior for the individuals in that stage. And while understanding it, we want to leave our judgments on the side. Non-judgmental. So being non-judgmental, we don't want to judge the person's views or feelings on a particular subject and be able to see ourselves in their shoes. Respect personal space. If possible, stand 3 feet away from a person who is escalating. Safety must come first. Proper spacing better helps you and all involved to safe state. Safety must come first. Proper spacing better helps you and all involved stay safe. Remember to keep a safe distance and a respectful spacing between you and the individual escalating. Use non-threatening body language. Body language communicates more than just words. When someone is upset, they hear words less. So it's important that we role model in our body language what we want to see from the individual. So we will ask individuals to have a relaxed stance with an open body posture without pointing. The picture that's on this particular screen is what not to do when de-escalating. Avoid overreacting. Be rational. You cannot control another's behavior. You can control your own. While we are attempting to support someone in controlling themselves, we must role model this behavior by controlling ourselves. Practice, practice, practice. Practice with a colleague, practice in the mirror, practice receiving different information and pay attention to your own reactions. We can't control another's behavior, but we can control our own. Focus on feelings. Name it to tame it. Dr. Dan Siegel. Individuals have used the phrase, "I'm feeling some type of way." Dr. Siegel suggests that if we can identify our feelings, we can more successfully work through negative feelings. As individuals are working on their recovery, they sometimes find it difficult to put the right words to what they're feeling. Be patient and allow individuals to focus on their feelings and give them ample time to express them. Avoid a power struggle. Redirect questions and comments that are not relevant to bringing resolutions to the immediate situation. Many individuals working through their recovery process and wellness have felt and experienced a great deal of powerlessness. During intense moments, their behavior may be a reflection of them trying to maintain and hold on to power. So avoid the power struggle and move the conversation to things more neutral. Set limits. Remind the person about working agreements, especially related to courtesy and respect. Often in the behavioral health system settings, we form working agreements with those we are serving. During times of escalation, remind the individual that we have agreed to be courteous and respect one another. It is okay during the escalation to be firm on the limits for the conversation. Choose wisely what you insist upon. It's important to be thoughtful in deciding which rules are negotiable and which are not. This reminds us of that power struggle. During our engagements, during an escalated time, it is important that we choose wisely the things that we will insist upon. What are those things that are not negotiable? And what are those things where we can give a little in order to resolve the conflict? Allow for silence and reflection. Silence can be golden. It is during this time that it is okay to take a breath, to take a pause. This allows both you and the person or individuals who are escalated to think and process their feelings. Allow that time for silence and don't move on until it's comfortable to do so. And number 10, allow time for decisions. Give individuals time to process. As we're working through our behavioral health changes in life, sometimes this may not come as quickly to some as it will for others. Allowing each individual the time that they need to process the conflict will help de-escalate and move forward with resolutions and solutions to the conflict. Resolution. Forgiveness is a key concept in conflict resolution. Forgiveness does not mean forgetting that the conflict happened or erasing the emotions that created it. It does mean accepting that conflict happened, accepting and working through how it made one feel, accepting the consequences that it had, and letting those actions and consequences exit in the past.
Thank you, Tyrell, for tying that all together. Self-care after conflict. How important is that? Whenever we serve, it is important to take care of ourselves, but especially after you have gone through a resolution process and de-escalation. So after conflict has been resolved, there's usually still work to be done. So consider what you need for yourself. For example, take time to breathe. Take time to take a walk. Take time to talk with a trusted advisor or professional. Pause and evaluate the experience. What are the next steps? And then follow up. But make sure through all of this, you are taking care of you. You are pausing to ensure self-care after conflict.
Thank you. And you are welcome to join the IRIS network. The link will be provided in our list of resources. In the list of resources, we will have a reference page for all of the material used in developing this training. Also, please join the 3C Recovery Support Training Institute by scanning the QR code or following us on our webpage. Thank you.